Welcome to King's.
Thank you.
You have appointed with Dr. Tamkeen.
Yes, that's correct.
Sure, so I'll be assisting you, ma'am. Let's go to the assessment room. How are you today?
I'm very good, thank you. How are you?
I'm good. All good, ma'am. Please come with me.
Oh, sorry.
Okay. So have a seat, ma'am. I'll check your vital signs. Please, ma'am. Dr.
Hi, doctor.
Good afternoon.
Good afternoon, how are you?
Fine, thank you. Please have a seat.
Thank you.
How are you doing, Mirna?
I'm very good, thank you. How are you?
Alhamdulillah, all okay?
Alhamdulillah.
Tell me, how can I help?
So I've had a cardiologist back in Abu Dhabi, and I was looking for a new cardiologist here, so I don't have to go back and forth since we live now in Dubai.
Okay.
I installed an ICD about 3 years ago, June 2017. I was diagnosed with ARVC after a series of weird heart conditions amongst my family. I have a sister who passed away in 2011. She was working out at the gym, and her heart just stopped right then and there. My other sister, she collapsed at the gym, and then the doctor back in Cleveland Clinic, he saw some consistencies. So he did some tests on my sister, and she was diagnosed, and he said it's most likely genetics. So he did the tests on me as well, and that's where he diagnosed me with ARVC, and we have the genetic death gene as well.
Okay.
And that's when he installed the ICD. He said it's necessary. And then he also tested the rest of my siblings. They also have it, but my parent, we don't know which parent we got it from. So now I decided, I know I need to periodically check my ICD every 6 months, but I haven't done so since I moved here about 2 years ago. So I think it's time now, because I know I can't work out a lot and stuff, but I started working out again, just slightly not straining myself, and I need to keep my pace, my ICD in check, just to make sure everything is okay, and that's why I'm here.
Okay.
Yeah.
So, do you have any complaints? Do you have any complaints of chest pain, shortness of breath, palpitations, dizziness, loss of consciousness?
Not loss of consciousness. It's like I can feel that I'm about to pass out because my heart rate goes really, really fast, and then I can feel that I'm about to pass out, but I've never actually passed out. The last time I passed out because of my heart was when they were doing tests on me. My heart rate, like I can feel it increase from time to time. My doctor calls me from now and then to tell me that the ICD transmitted unusual heart palpitations, or if my heart rate went up to 200. So he calls me and he asked me if I was working out or if I was doing anything. Last time he called me was back in May, 5 months ago, and he said my heart rate went up to 203. But we were in lockdown, so obviously I wasn't doing anything. I was at home.
But you were asymptomatic. There were no symptoms.
No, there were no symptoms. I couldn't feel anything, but my ICD did transmit that there was something abnormal. The time before that, it was the same thing, but that time I was doing a lot of activities, so he told me like I need to stop and relax. So he said like he's gonna keep monitoring my ICD from now, like closely from now on, just to make sure everything is okay. Shortness of breath, I do feel it from time to time, like if I'm going up the stairs, if I'm walking a lot, or if I'm doing any like activities. Chest pains, don't think I've ever felt anything that's worth mentioning. But yeah, these are the symptoms I feel.
And the ICD was placed only because you had a family history of sudden cardiac death, and you didn't have any symptoms, right?
I haven't had any symptoms, no. He did some tests on me where he inserted 2 tubes through my thigh, and he did, from what I understood, like it was testing my heart in different situations. So if I was too happy, too scared, I believe that was the test. I'm sorry, my memory is not serving me well. And I know at some point my heart rate went up to 360, and that's when I lost consciousness, and they had to revive me again. And I know my heart probably stopped for about like 20 seconds. But that was it. That's how he detected that there's something abnormal with my heart. And then after the testings, he realized it was ARVC, and we had that gene.
So you are sure that ARVC is a congenital, it's a channelopathies where you have abnormal tissue in the heart muscles, which might give you very bad arrhythmias, and it is actually it runs in the families, and the only treatment for this disorder is that we place an ICD, which they have rightly done so, and it prevents the sudden cardiac death.
Yeah.
But now, because you have placed ICD, it has never shocked you, right?
Not me, no, but my sister, it has shocked her over 3 times, and she had to go through a 6-hour surgery where they had to
Ablate.
Yes, ablate, yeah. But for me, no, never. It was very close, but I never had to be shocked so far.
Okay. And do you exercise and you don't have any issues with it?
My exercises are very mild, so I don't strain myself. I only walk. I do like light weights. I take a lot of breaks between each exercise. I keep monitoring my heart. Like from what I can see from my watch or my phone, my heart rate does go up to 150 in a very minimal exercise.
Okay.
So, and sometimes it goes up to 180, but that's when I just stop and leave.
Okay.
But yeah, like it's very, very mild. Last time I was exercising was end of 2019, but I had to stop because that's when I started feeling dizzy. My heart rate was like, at some point I had to scan it and like lie down because it was going really, really fast. So I had to stop.
And you don't have any other comorbid conditions like high blood pressure, diabetes, high cholesterol?
No, I don't.
Okay, and you don't smoke?
No, I do smoke.
You do smoke.
Yes.
And okay, so what will I do? What my plans will be for you basically is, because it has been a couple of years since you have not had an interrogation done of your device, so we'll just have an interrogation of your device done to make sure that it's working properly. And because just you have complaints of palpitations when your heart rate goes high, so what I'm going to do is basically your device is going to pick that up. But if it's the heart rate is not that high, or if it's not any abnormal rhythm, it won't do anything, it will just monitor it. But if God forbid there's an abnormal rhythm, it will shock you. Your palpitations, your heart rate can be a normal sinus rhythm, which the device is not going to do anything because that's a normal thing. But let's do a 24 hours Holter monitoring. We'll put your device, we'll hook you with the device, and it will measure your heart rate and your rhythm for 24 hours. And we'll see what kind of palpitations you're having it. Are you just having sinus tachycardia, or is something else going on? And then we'll plan for an echocardiogram, which is an ultrasound of the heart, which will tell us about the functions of your heart, about the musculature of your heart, about the valves of your heart. In ARVC, you usually have fibrofatty infiltration of the right ventricle, and the right ventricle gets dilated and the functions decrease, so that also we'll be able to assess with that. And then we'll have some blood tests done on you to make sure that your potassium, your magnesium, your thyroid functions are fine.
Okay.
So that's the plan. If you don't mind, I'd like to examine you.
Yeah, of course.
Please. Please lie down.
Okay. Sorry, let me just take my shoes.
So just checking your pulse. Relax. Your heart sound look perfectly all right, and I can see there's a scar of the ICD placement there. Absolutely.
Yeah.
So can you just come up now?
Sure.
Yes. The legs down. Okay. Let me listen to your lungs. Take a deep breath. and out. Deep breath and out. Deep breath and out. Deep breath and out. Okay, I think everything is fine. So as I said, we'll plan for some blood tests. We'll have an echocardiogram done and a Holter monitoring to assess what kind of arrhythmias are you getting. And then we'll ask the people who have placed the device to interrogate it, and we'll get the information how is the device working.
Okay, that sounds great.
Thank you
you
very
so
much.
much, doctor.
Thank you very much.
Thank you.